Good afternoon everyone. This is Tamilselvi from the Department of Foods and Nutrition, Deakin College. Today we will see about the topic arteriosclerosis and coronary heart disease. Arteriosclerosis. Arteriosclerosis, it is one of the disease. It is characterized by thickening, loss of elasticity and calcification of arterial walls. So, arteriosclerosis is nothing but one of the disease, and arteriosclerosis and atherosclerosis both are similar. But arteriosclerosis means only thickening and hardening and narrowing of your arteries, and it includes calcification. So calcification is one of the process that means calcium salts when accumulate in your arteries that will become a narrowing your heart arteries. That is the arteriosclerosis, and it is resulting in decreased blood supply, particularly to the cerebrum and lower extremities. So the disease, what will happen? It's a decreased of blood supply and decreased of blood flow. That is the arteriosclerosis disease, and it is often develops with aging, hypertension and diabetes. So these are all the causes of arteriosclerosis. When aging and hypertension and diabetes, so in the causes of arteriosclerosis. And this is the front view of showing cross section of arteries. So these are all the some of image. So normal, that is the diseased, narrowed your arteries, and this is the diseased block. So in the blockage, it's cholesterol and other calcium substances, anything. And this is the image of progression of arteriosclerosis. So progression means it's developed of your arteries that will lead to arteriosclerosis. So this is the normal of your arteries, and this is a particularly occluded. That means develop the blood clots and other calcium substances and other blood cholesterol. So that is, and this is the finally leads to arteriosclerosis. That is 95% of blockage. Okay. And risk factors. So what are the risk factors in arteries disease? That is the high blood pressure, hypertension and high blood cholesterol, and smoking, obesity, physical inactivity, diabetes, stress. So these are all the controllable, because hypertension or high blood cholesterol, obesity, these are we can follow the diet through diet, some medications, take some meditations. So these are all the controllable risk factors. And this is the uncontrollable risk factors, because gender, hereditary, age. So this is we cannot change our lifestyle pattern. So this is the uncontrollable risk factors. And next we will see what are the major 3 risk factors. That is hypertension, high cholesterol and cigarette smoking. This is the major and very important risk factors of coronary heart disease. Okay, hypertension. Hypertension, already we know that. So that is called high blood pressure, normal systolic and diastolic pressure. So normal systolic is 110 to 130 mmHg, and normal diastolic pressure 70 to 90 mmHg. And symptoms of coronary heart disease. First, in the initial stage of coronary heart disease, when the development stage, symptoms is not there. Okay, first thing, symptoms is not identified in the initial stage of coronary heart disease. So next, when we'll have some heart failure and heart attack, that time chest pain, shortness of breath, heaviness, tightness, pain in the chest and burning sensation, pressure of and squeezing sensation. So these are all the symptoms having when occur in the heart chest and heart pain or heart attack. Okay, and pain may vary. Pain, it's a different pain we have that, and perhaps no pain. And causes and consequences of coronary heart disease. So lack of oxygen due to ischemia. So narrowing and very hardening and thickening arteries, we will see that. So lack of oxygen due to that ischemia. Ischemia is a lack of blood supply and lack of blood flow in your arteries. That is the ischemia. And narrowing of your coronary arteries. So narrowing and heart response with angina, and finally heart attack. So that is the myocardial infarction And local ischemia usually due to the thrombus. Thrombus means it's a blood clotting in your arteries, and embolus. Embolus also clot that has moved from another side. So one place to another side we can move that. That is the embolus, and possible it is a permanent damage. Okay. Okay, next complications of coronary heart disease. Complication in the sense, first complication is a coronary heart disease. When the atherosclerosis it's become thickening, narrowing of your arteries, it's close to your heart, may develop the coronary heart disease. That is chest pain and angina and heart attack, heart failure. This includes the coronary heart disease. And next one, peripheral heart disease. So peripheral heart disease is it's nothing but same thing, narrowing of your arteries and arms and your legs. So this development of the circulation problem. Peripheral means it's related to circulation problem only. The blood flow of your arteries is it's very low. So that is the peripheral heart disease. And another one is aneurysm. So aneurysm is a very important and very severe complications of this coronary heart disease, because the aneurysm that is occur in anywhere at any time. So aneurysm means build-up of your arteries, it's become bulging. So that is the aneurysm. And next, the treatment. Treatment of coronary heart disease. Treatment, what are the treatment? Lifestyle changes and modifications, and finally surgery. So lifestyle modifications, it includes through your diet and medications and meditations, changing your lifestyle, your working, all those things, changing your lifestyles. And lifestyle changes, it includes change of your habits, low fat diet and lower weight, increases exercise and stop smoking. So changes your habit in the sense, in case your chain smoker means gradually reduce the smoking habit. And low fat diet, it includes high fiber rich foods includes your diet. So that is low fat diet, and lower weight also, and increases exercise time, at least half an hour per day exercise will do that, and stop smoking. Next, medications. So medication in the sense, beta blockers and nitroglycerin and other nitrates, calcium channel blockers, aspirin and cholesterol lowering drugs, levostin and cholesterol, cholestyramine, etc. So digitalis and ACE inhibitors, diuretics. So these are all the medications of treat the coronary heart disease. And surgery. Surgery to the treat of coronary heart disease, balloon angioplasty and atherectomy and laser angioplasty, stent insertion, coronary artery bypass operation. So CABG, that is the surgery. And effects of smoking. So effects of smoking means smoking is the main one of the reason and risk factors of atherosclerosis. So for adult males, smoking has declined from 53% to 38%, and remaining women at 30%. So it has increased for younger and teenage women. So heavy smoker 20 to 30 cigarettes per day using. So this is the effect of smoking. And stress. Stress include socio-cultural mobility and socio-economic status and status inequality, educational level, anxiety and neurosis, life dissatisfaction and life change and behavior pattern. These are all the causes of stress. So this is also one of the risk factor of coronary heart disease. And HDL. HDL means high density lipoprotein. And high density lipoprotein seems to have protective effect against development of atherosclerosis. So this cholesterol, that means this protein is very important. Include your diet, and it is a form of atherosclerosis in which deposit of yellowish plaque. So plaque also very important, that is cholesterol blockage your arteries. So HDL is very important to include your diet, and women have higher concentrations than men. And most important of all lipid risk factors, and below 35 mg per dl, that is prescribable, and exercise has effective, and create weight has negative effect. So finally, diet. So reduce saturated fats and increase polyunsaturated fats, higher proteins to fat ratio and count calories. So calorie wise, we can reduce the calorie content and includes high fiber rich foods and low cholesterol, low high density lipoprotein only. We can use the cholesterol components. So this is the diet. Thank you.